Hello everyone. I wanted to take a moment to express my heartfelt gratitude to all of you who have subscribed to my channel. Your support means the world to me and it motivates me to create even more content. If you are new here and haven't subscribed yet, I invite you to join our Grow community. Hit the subscribe button and be a part of our journey. Thank you very much for being here. And without further ado, let's dive into today's video. This is a scenario. Okay, based on this scenario, we're going to answer the following two questions. So it says Sarah is a 28 years old female with a medical history of asthma, diagnosed at age of 10 and a background of seasonal allergies. Recently, she has been experiencing increased wheezing, shortness of breath, and coughing, particularly at night and during exercise. Over the past week, Sarah has noticed significant worsening of her symptoms, which has raised her concern about her asthma management. So in this scenario, she is 28 years old, and she is known asthma patient, and the asthma is diagnosed when she was 10 and has history of seasonal allergies. Recently, she has wheezing, shortness of breath, coughing, particularly at night and during exercise. Over the past week, Sarah has noticed significant worsening of her symptoms, which has raised her concern about her asthma management. So based on this, we are going to answer the following questions. Question number 1. Which medication should Sarah primarily rely on for immediate relief during asthma attack? A. Fluticasone, B. Montelukast, C. Albuterol, D. Salmeterol. Okay, let's see one by one for each options. Okay, option A, fluticasone. It is inhaled corticosteroid used for long-term management of asthma. It helps reduce inflammation, but it does not provide immediate relief during asthma attack. Okay, it is a long-term management of asthma, but it cannot be treatment option for immediate relief during asthma attack. So it cannot be the answer. So option A cannot be the answer. Option B, Montelukast. This is interleukin receptor antagonist. Okay, that helps control asthma symptom over time. It does not effective for immediate relief during asthma attack, so it cannot be the answer also. Option C, Albuterol. It is short-acting beta agonist that acts quickly relax bronchial muscle and is first line treatment for immediate relief during asthma attacks. So it is a potent for bronchodilator and it is short acting beta agonist, so it can relieve during asthma attack. So option C is the correct answer. Option D, Salmeterol. It has similar mechanism of action like Albuterol, but it is long-term management of asthma. So the answer is C. Question number 2. What lifestyle modification could help reduce Sarah's asthma trigger? Based on the above scenario. Okay. A. Keeping windows open to allow for fresh air. B. Regularly cleaning her apartment to reduce allergen. C. Exercising outdoors in high pollen position. Question number 2. What lifestyle modification could help reduce Sarah's asthma trigger? A. Keeping windows open to allow fresh air. B. Regularly cleaning her apartment to reduce allergen. C. Exercising outdoor in high pollen season. D. Adopting more pets. So let's see each option. Option A, keeping windows open to allow for fresh air. Okay, this could introduce outdoor allergen like pollen, okay, into her home, so potentially worsening her asthma. So it cannot be the answer. Option B, okay, regular cleaning her apartment to reduce allergen. It is the correct answer because it is beneficial. It helps to minimize dust, molds, and pet daughters and other allergens that can trigger asthma symptom. So this is the correct answer. Option C, exercise outdoor in high pollen season. This could increase her exposure to allergen, so particularly pollen, which may worsen her asthma symptoms. So it cannot be the answer. Option D, okay, adopting more pets. Pets can be a source of allergen, so it cannot be the answer. So the correct answer is B. Question number 3. What is asthma primarily characterized by? A. Increased lung capacity. B. Hyperresponsiveness and mucosal edema. C. Chronic cough without inflammation. D. Permanent airway obstruction. Okay, asthma is characterized by, okay, reversible airway obstruction. Okay, so increased lung capacity cannot be the answer. Asthma is characterized by decreased lung capacity due to airway obstruction, so not increased lung capacity. Option A cannot be the answer. Option B, hyperresponsiveness and mucosal edema. Asthma involves airway hypersensitivity or hyperresponsive to various stimuli such as allergen, exercise, or irritants, and inflammatory changes, so including mucosal edema, for example, increased mucus production, which lead to narrowing of airway. So asthma is characterized by hyperresponsiveness and mucosal edema and inflammation. Okay, this is the characteristic of asthma. So the correct answer is B. Chronic cough without inflammation, it is not the characteristic of asthma. While chronic cough can be a symptom of asthma, it is typically associated with inflammation and is not characterized by absence of it. So C cannot be the answer. Option D, permanent airway obstruction. Asthma is characterized by reversible airway obstruction. It is not permanent. So option B is the correct answer. Question number 4. Which cells are primarily involved in inflammatory response triggered by allergy? A. Reverse cells. B. Neutrophil. C. Mast cell and basophil. D. Platelet. Okay. Red cells, the cells are primarily involved in oxygen transport and do not play a role in inflammatory response for allergy, so option A cannot be the answer. Option B, neutrophils. While neutrophils are important in immune response and inflammation, they are not the primary cells involved in allergic reaction. Their role is more prominent in bacterial infection or acute inflammation. So option B will not be the answer. Option C, Mast cells, those cells are crucial in allergic response. Mast cells release histamine and other inflammatory mediator upon activation by allergen, so lead to a symptom of allergy and asthma. So the answer would be C. Option D, or platelets primarily involved in blood clotting, is not involved in allergic reaction, or most likely to cause a transfusive pleural effusion. A. Pneumonia. B. Malignancy. C. Heart failure. D. Tuberculosis. Okay. Option A, pneumonia. It is typically lead to exudative pleural effusion rather than transitive pleural effusion. Okay, because it causes inflammation and infection in the lungs tissue, so will lead to exudative pleural effusion rather than transitive infusion. So as a result of pneumonia or inflammation, we increase permeability of the pleural surface. So the fluid will link into the pleural space or pleural cavity, resulting in exudative pleural effusion rather than transitive. So option A cannot be the answer. The same is true in option B, malignancy. Okay, tumor can cause exudative pleural effusion due to inflammatory response and blockage of lymphatic drainage. Okay, it cannot be the answer. Option C, heart failure. This is the correct answer, because if there is heart failure, there is a backflow of fluid from the pulmonary artery into the lungs, and also increased pressure of the blood vessel, resulting in the escaping of fluid from the pulmonary vessel into the pleural space, resulting in increased accumulation of fluid within the pleural space, that is transitive pleural effusion. And not only heart failure, but also if decreased albumin, okay, as a result of liver disease, would result in decreased oncotic pressure. Okay, oncotic pressure resulting in the accumulation of fluid within the pleural space will increase. This type of fluid, which is found in pleural effusion, is called transitive. So heart failure and and also increase hydrostatic pressure and decrease oncotic pressure result in transitive pleural effusion. So the answer is option C. Question number 6. Which one of the following is true about the relationship between latent TB infection and active TB disease? A. Latent TB infection cannot progress to active TB disease. B. Latent TB infection is always active of tuberculosis. C. Latent TB infection can progress to active TB disease. D. Latent TB infection and active TB disease are mutually exclusive. Okay, option A. Okay, this statement is false, because latent TB infection can progress to active TB disease, so especially if the immune system become weakened. Patient with chronic disease, patient with HIV, patient with may get malnutrition. Okay, so latent TB may progress to active TB. As you know, latent TB is, there is a microorganism within the lung, but this microorganism is engulfed or controlled by our immune system. So since there is a microorganism or Mycobacterium tuberculosis in the lung, it waits or it waiting for opportunity, okay, and will progress to active tuberculosis. So option A cannot be the answer. Option B, latent TB infection is always active of TB. This statement is misleading. It is false. While the latent TB infection indicates that a person has been infected with tuberculosis, Mycobacterium tuberculosis, it does not mean they have active disease or contagious. Okay, this latent TB infection has no any sign and symptom, and it cannot transmit from one person to another person. Okay, so this is the characters of latent tuberculosis. Option C. Okay, latent TB infection can progress to active tuberculosis. Yes, this statement is true. Individuals with latent TB infection are at risk for developing active tuberculosis. Particularly, they have, for example, they have a compromised immune system or other risk factors. So latent TB, the chance to progress to active tuberculosis. So the answer is option C. Option D. Okay. Option D, latent TB infection and active tuberculosis, these are mutually exclusive. This is false. Okay, because a person can have latent infection and later may develop active tuberculosis, so they are not mutually exclusive. So question number 7. A 30 years old male comes to the emergency department after experiencing sudden chest pain and shortness of breath while playing a basketball. He mentions feeling a sharp pain on one side of his chest that worsened with deep breath. Upon examination, the physician notes decreased breath sounds on affected side and hyperresonance percussion note. Based on patient's symptom and examination findings, what condition most likely occurring? A. Pulmonary embolism. B. Pneumothorax. C. Pneumonia. D. Asthma attack. Okay. Option A, pulmonary embolism. It cannot be the answer because pulmonary embolism, it is not characterized by hyperresonance and it is not localized pain, chest pain. Okay. While pulmonary embolism can cause a sudden chest pain and shortness of breath, it typically does not present with decreased breath sounds or hyperresonance on percussion. So it cannot be the answer. Okay, option B, sudden onset of sharp chest pain, shortness of breath, decreased breath sounds on the affected side, and hyperresonance, which is on percussion note, are a classical signs of pneumothorax. The hyperresonance is due to presence of air in pleural space, which leads to decreased lung expansion on the affected side. So option B is the correct answer. Option C, pneumonia. Okay. It is not typically present with decreased breath sounds, but is more likely to produce dulls on percussion rather than hyperresonance because there is an inflammation, so there may be accumulation of fluid, so the patient will not have hyperresonance. It also usually involves systemic symptoms like fever and cough, which are not mentioned here. So option C cannot be the answer. Asthma attack, totally it cannot be the answer. Okay, because asthma attack can cause shortness of breath and wheezing, but it does not typically present with sharp localized chest pain or hyperresonance. And also asthma has breath sounds may be diminished due to airway obstruction rather than pleural involvement, because asthma is conducting zone problem. Okay, it is generalized constriction of bronchus rather than in the lung or respiratory zone problems. Okay, So asthma is conducting zone problem rather than respiratory zone problems, so it cannot be the answer. 8. What is the primary physiological change that occur in pleural space during pneumothorax? A. Increased negative pressure. B. Introduction of air leading to positive pressure. C. Accumulation of fluid. D. Increased lung volume. Okay. Option A, increase negative pressure. Normally the pleural space is maintained at a negative pressure relative to atmospheric pressure. In pneumothorax, this negative pressure is disrupted. So option A cannot be the answer. Option B, introduction of air leading to positive pressure. In pneumothorax, obviously in pneumothorax, air enters the pleural space, which disrupts negative pressure and can lead to positive pressure. Okay, can lead to positive pressure. So in the pleural cavity, so this results in the collapse of lungs on affected side. So it can be option B is the correct answer. Option C, accumulation of fluid. This is not characteristic of pneumothorax. Fluid accumulation in the pleural space is termed pleural infusion. Okay, pleural infusion, which is different conditions. Pneumothorax and pleural infusion is different. Okay, accumulation of fluid is called pleural infusion. Accumulation of air within the pleural space is called pneumothorax. So this accumulation of fluid is another condition. It is not a characteristic of pneumothorax. Increase lung volume. In pneumothorax, the opposite is true. Decrease lung volume. Okay, because there is accumulation of air within the pleural cavity or space which can collapse the lung. So decrease lung volume rather than increase lung volume. So option D cannot be the answer. 9. A 45 years old male with history of peptic ulcer disease present to emergency department. He reports a constant abdominal pain that is not relieved by medication, including proton pump inhibitor and antacid. After several months of medical therapy, his symptoms persist. What is the most appropriate indication for surgical intervention in this case? So from the scenario, okay, the patient has been treated for several months, but still there is no any improvement. So the indication for surgery is bleeding, no bleeding, because the problem is treatment failure. Okay, perforation, so it cannot be the answer because the problem is treatment failure. Okay, intractability, this is the correct answer. Intractability means the patient has taken several times or treated for several months, but still there is no any improvement. So this is option C is the correct answer. Obstruction cannot be the answer. So the answer is C. Question number 10. A patient with osteomalacia is found to have a deficiency in which vitamin that is crucial for proper bone mineralization? A. Vitamin A. B. Vitamin C. C. Vitamin D. D. Vitamin K. Option A, vitamin A, it is important for vision. It does not directly involved in bone mineralization. Okay. Option B, vitamin C. This is essential for collagen synthesis and overall health of bone health, but the deficiency lead to scurvy rather than osteomalacia. Option C, that is vitamin D. This is crucial for absorption of calcium and phosphorus in the, from the intestine. So this can be the answer. This is the answer. Option D, that is vitamin K. This vitamin plays a role in blood clotting and bone metabolism. Okay, but it is not primary vitamin associated with osteomalacia. So the correct answer is option C. Thank you very much. Don't forget to subscribe and like and share. Thank you so much. Bye bye.